Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. The VA has improperly made payments in the tune of $6.8 million. We got to dive into this. Did this impact you? I don't know. Let's find out what's going on because this is a big deal. It's a big number, $6.8 million in improper payments. And this has to do with the dated claims that were placed when they were submitted. So somehow the VA screwed up the dates of the claims and thus the back pay and all that stuff got messed up. And here we are. I don't think that this is getting enough attention. So it could have impacted you. It could impact somebody you know. So please hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. Every thumbs up, every minute watched really does help to spread the word, and that's what we're trying to do. If for some reason you think that your payments, your back pay for your last claim, for example, or a couple claims ago, depending on how many you file, if you think that maybe the calculation was off, I suggest working with an accredited veteran service officer or veteran service rep that can dive into the VA's VBMS system and see if they can figure it out for you. And they can also request an audit on your back pay and pay from the VA as well. So with that, again, please hit that thumbs up and subscribe. Those are really two of the asks, and let the video run. That would, I guess, be the third in this case. All right, so let's move on. Misdated Veterans Disability Compensation Awards for the PACT Act resulted in at least $6.8 million in improper payments, the Department of Veterans Affairs watchdog said this week. The VA's Office of Inspector General reviewed a sample of 100 PACT Act-related claims completed in the first year of the law, which VA has said is perhaps the largest health care and benefits expansion in its history. For that example, or for that sample size of 100 PACT Act-related claims, it's only 100. From that example or sample, the OIG estimated that incorrect effective dates were assigned for about 31,400 of the 131,000 claims, or about a quarter of the claims. So with that sample size, they're estimating that about a quarter of the claims, which represents about 31,400, have the incorrect effective dates. There were a lot of different dates going around. There were dates that when the law went into effect, if you filed by this date or if you had your intent to file in by that date. So there was a lot of different dates that could be used. Another 2,300 or so claims had the potential to affect veterans' benefits by an unknown monetary amount, an OIG report said. And the OIG warned, they put out a warning that if the VA continues to make the same mistakes, it risks issuing millions of dollars more in improper disability payments. So that's a frightening statement because, look, if you're short, cool, you got to grind a little bit and get that money back, right? If they shorted you. But if they overpaid you, well, they like to claw it back quite quickly unless you work with them on creating some sort of a payment plan. So be aware of that. If you think you got too much, that might also be another issue, and you might want to start saving a little bit in the event that the VA wants to jump back on you. President Joe Biden signed the PACT Act into law in August of 2022, expanding health care to veterans exposed to toxins during their service. Burn pits used at U.S. bases during the wars in Iraq and Afghanistan were blamed for illnesses, including cancers, and brought this issue, right? Let's see what they have to say. So, brought this issue to the forefront, right? But pre-9/11 veterans who suffered from toxic exposures are also covered under the PACT Act. So it was really, there was a lot of focus on Gulf War stuff, and there was some stuff in there for some others as well, including Vietnam vets with a couple new things as well. The new law brought a lot more veterans to VA because they opened up the doorway to VA healthcare in addition to presumptive conditions. They also opened up another funnel into the healthcare system. Nearly 740,000 veterans enrolled in VA healthcare during the first 2 years of the PACT Act. That was a 33% increase over the previous 2-year period. So what they did was they lowered the requirements, or really kind of just eliminated the requirements for a whole lot of veterans to access VA healthcare. Prior to that, there was a list of, I don't know, maybe 7 different things that would qualify you into VA healthcare. The 2 most common ways into VA healthcare used to be you either were below the poverty level or you had a service-connected condition. So moving on here, it says, and the VA said last month that it had enrolled over 2.1 million PACT Act related claims, or completed, excuse me. The VA said last month that it had completed over 2.1 million PACT Act claim-related claims. Republican Representative Mike Bost, the chairman of the House Committee on Veterans Affairs, told National News Desk in a statement that the Biden administration failed to prepare VA claims processors for the PACT Act. Bost said the previous administration botched the PACT Act rollout. These incorrect dates have caused millions of dollars in improper benefit payments to veterans, Bost said in the statement. It's clear that VA needs to better train its employees. Veterans shouldn't have to deal with sloppy work from the VA, and Americans shouldn't have to shoulder the burden of VA's wasted taxpayer funds. Bost said House House Veterans Subcommittee will hold a hearing about the issues highlighted in the OIG report. Jim Lorraine, the president and CEO of America's Warrior Partnership, an advocacy organization for veterans, said rolling out the PACT Act was a massive undertaking for the VA. Absolutely. And not only was it a massive undertaking, if you recall, in the legislation, there was a rollout schedule. They were going to eat the elephant one bite at a time. And President Biden, when he announced it, said everybody can apply all at once, Lorraine said. The PACT Act was definitely needed, he said, but guidelines are complex. And he recalled many people within the veteran community questioned VA's ability to handle the influx of claims in the early days of the law. And I agree. The PACT Act expanded the presumptive conditions that qualify a veteran for benefits based on their exposure. They don't have to prove that their service caused the condition because it's presumptive. A variety of cancers and other illnesses, including post-service asthma, bronchitis, and emphysema, are now presumptive conditions from toxic exposure. There's a longer list than that. Don't think that that's it. The OIG report included recommendations for VA staff to prevent additional mistakes with dates of PACT Act claims. Among the recommendations, OIG suggested officials create a job aid for claims processors on how to determine the correct effective date for PACT Act related claims. The watchdog suggested removing an outdated effective date builder from the VBA's internal job aids page. So in other words, there's a lot of different ways that you can calculate an effective date, right? It could be the date of your claim. It could be the date of your intent to file. Those are kind of the most common. But when you throw in a new law, sometimes it can go back to the start of that law if you apply by a certain time. In other cases, let's use the PACT Act for an example, and just say let's say like sinusitis, right? So presumptive of sinusitis, let's say PACT Act goes into effect, and you miss the first window that would take it back to the start of the law. And let's say that you file an intent to file. And now let's say that you get diagnosed for sinusitis 6 months after your intent to file, and then you file your claim for sinusitis. They're not going to go back to your intent to file date. They're not going to go back to the law date. They're going to go to your diagnosis date, most likely, because anything prior to the diagnosis, you didn't have it. You weren't diagnosed for it. That's why it's so important to get in and get diagnosed. Thanks for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.